Hi friends, how are we doing? And we're welcome back to the channel. Today we just want to talk about antibiotic susceptibility testing. Now, what is this? This is a method that is used in microbiology to determine the efficacy of different kinds of antibiotics. Now, in times past, when there was not much pressure on antibiotics, people sometimes used to just prescribe and use any kind of antibiotics for any kind of infection. But going forward, it has been important to be able to test out the right kind of antibiotic to use for any kind of pathogen or illness. Now, interestingly, this method is not new. It's been around since the 1960s, and there are many ways of doing it. But one of the most common ways of doing it is the Kibibauer's method, which is also called the disc diffusion method, which has been around since the 60s. And it's a method where you have a paper disc that has been impregnated with different types of antibiotics at different concentrations, different dosages, and this disc is used. You inoculate your bacteria or different bacteria that you want to test this disc again. You inoculate them onto Miller Hilton's agar, and then fix your disc and allow for 24 hours, and then come to read. There are standards that we use to read these discs. There's a CSLI standard, Clinical Standards and Laboratory Institute. They have a standard. I think the most recent one is 2024 or 2025. So we use this to read out of this, understand. And what is it that we are reading in this? When you have incubated and allowed these antibiotics to work, and then your bacteria has been grown in a petri dish, you now need to look, is there what we call a zone of clearance? That means this antibiotic, has it been effective against the bacteria? If it's been effective against the bacteria, you notice that it is able to clear places on the plate. So that clearance tells you that the antibiotic is effective in combating the pathogen. Now, if you don't have such a clearance, then you know that the antibiotic was unable to fight against the pathogen. So this is a very important test. In the process of running the test, like I said before, we use Moella Hilton's agar, which is a special agar we use. We also have what we call the McFarland standard, which is important. Now, this is a method of where we use turbidity. We use turbidity to determine the amount of bacterial cells which we'll be inoculating onto our plate. And what does this mean? Now, to standardize the test, you want to have a situation where you are taking approximately the same amount of bacterial cells and inoculating them on the petri dish. And so, in order to do that, we use what we call a McFarland standard, which is there's a pre-prepared one you can buy, where you look at the turbidity and you compare the turbidity of your own bacterial suspension with that turbidity, with the belief that using your eye, that's an eye test, you have the belief that if they are roughly the same in terms of turbidity, then it means that you have roughly the same amount of bacterial cells in all of your solutions. We usually believe that it's about 1.5 times 10 raised to the power 8 colony forming units of bacteria that is present when you standardize using your McFarland standard. And in the event that your bacterial suspension is too thick, you can dilute it with normal saline, and this is important. So we usually have a bacterial suspension of all the bacteria that we want to test our antibiotics against. And then when we have this bacterial suspension, we compare with McFarland standard. If there's a need to dilute, we dilute until we are sure that it has been standardized. And then we inoculate out of all these our bacterial suspensions which have been standardized, put them on our Mueller Hilton plates, and then we put our disc over them and allow for about 24 hours of incubation. So this is the process, and it's very important. It's very important for scientists that we understand this process, we understand what is happening, we understand the interpretation. Like I said before, we use the CSLI guidelines to interpret, or UCAST. It's another European body that we also use their standards to interpret. And what are we interpreting? We're interpreting the zone of clearance. How wide is the zone of clearance? We measure this diameter of the zone of clearance using a ruler, and then we match it up with our what we are checking. We match it up with the standards in the CSLI book, and depending, we are able to come to a conclusion. It's one of three things. It's either that the pathogen is resistant to the antibiotic or is sensitive to the antibiotic. Sometimes some say intermediate, but I think that term is being phased out. So we usually have resistant or sensitive. Thank you for listening to this and do have a beautiful day.